Bismillah ar-Rahman ar-Rahim. Today we are going to discuss the first lecture of cartilage. In this lecture we will describe the general structure of cartilage. We will know the different types of cartilage and we'll describe the structure and correlated function of hyaline cartilage and the structure and function of different cartilage cells. To begin with the definition of cartilage, cartilage is a special type of connective tissue, so it has all characters of connective tissue as being derived from mesoderms, as it is formed of cells separated by good amount of intercellular substance, while cartilage differ from the connective tissue that it is avascular. It does not contain blood vessels. The intercellular substance is characterized also by being rigid and rubbery, which gives it some degree of flexibility. It is very important to know that the cartilage is avascular type of connective tissue, does not contain blood. As the cartilage is considered a type of connective tissue, so it is composed of cells that are separated by good amount of extracellular matrix. The extracellular matrix include fibers and ground substance. The ground substance include macromolecules and tissue fluid. This is the general configuration of any connective tissue. Cells of the cartilage includes chondroplasts and chondrocytes. It is very important to know that the type of collagen fibers of the cartilage is collagen type 2. Today we are going to discuss the chondroplasts and chondrocytes. The cartilage is also characterized by being covered by connective tissue, which is called perichondrium. We have different types of cartilage. Regarding as this figure, we have three different types of cartilage. The most common type is hyaline cartilage, that is marked by blue color. This is the site of hyaline cartilage. We have also elastic cartilage and white fibrocartilage. The most common type is hyaline cartilage. We will begin with the hyaline cartilage. To know the sites of hyaline cartilage, we have very common site is the costal cartilage. The junction between the ribs and the sternum is formed of hyaline cartilage and called costal cartilage. We have also some cartilage in the respiratory passages, including the larynx, the trachea, and the bronchi. Also, the fetal skeleton is formed of hyaline cartilage. The articular cartilage or the joints are formed of articular cartilage that is formed of hyaline cartilage. Also, we have the epiphyseal plate of long bone is formed of hyaline cartilage. It is very important for every type of cartilage to know the sites where these cartilage are present. This is a long bone. The articular cartilage is the site with the joint. This is formed of hyaline cartilage. And this is the epiphyseal plate. The epiphyseal plate is the junction between the epiphyseal head and the diaphysis of the bone. It is formed also of hyaline cartilage. Hyaline cartilage in fresh state appears as bluish translucent substance. That's why it is called hyaline, because hyaline by Greek name it means glassy appearance. Regarding the microscopic structure of the hyaline cartilage, we will discuss the cartilage cells and the matrix and the covering connective tissue, which we call perichondrium. Perichondrium is the dense connective tissue. It is a dense irregular connective tissue that surrounds the cartilage. It surrounds all types of cartilage except the articular cartilage and the white fibrocartilage. The perichondrium covers all sides of hyaline cartilage except the articular cartilage. It covers all sides of elastic cartilage, but it does not cover the white fibrocartilage. Structure of the perichondrium. The perichondrium is formed of two layers. The first layer is the outer fibrous layer. It is a dense, irregular, collagenous connective tissue formed of collagen type 1. It is formed also of cells, fibroblasts, and blood vessels. The second layer is the inner chondrogenic layer. It is formed of one or two rows of cells called chondroplasts, and it contains no blood vessels. So the perichondrium is formed of two layers. The outer fibrous layer contains blood vessels, but the inner chondrogenic layer does not contain blood vessels. If we want to ask about the functions of the perichondrium, we will ask about the different function of every layer. The outer fibrous layer has two functions and the inner chondrogenic layer also has its own function. The outer fibrous layer, as we said, is formed of dense collagen fiber containing blood vessels. So the main function of this layer is to provide nutrition for the cartilage. We said at the beginning that the cartilage is a type of connective tissue that is avascular, does not contain blood vessels. So to take nutrition from blood vessels, it depends on the blood vessels that are present in the outer fibrous layer of the perichondrium. This layer also gives muscle attachment. Regarding the function of the chondrogenic layer, we said that the inner chondrogenic layer is formed of chondroplasts, so the function of this layer depends on the function of chondroplasts. Now we are going to talk about different cartilage cells. We have two types of cells in the cartilage, chondroplasts and chondrocytes. We are going to discuss cells of cartilage or bone cells. We have to mention whether these cells lies inside a lacuna or not. What is lacuna? Lacuna is an empty space or cavity that the cells lie inside this space or inside this cavity. Some cells lie inside lacuna, others are not. So when we are going to talk about cartilage cells or bone cells, we have to mention these cells lie inside lacuna or not. We will begin with chondroplasts. The origin of chondroplast, it comes from the undifferentiated mesenchymal cells that differentiate to give chondroplast. Chondroplasts are present in the inner chondrogenic layer of the perichondrium. The light microscopic appearance, we have to talk about the shape of the cell, the nucleus, and the cytoplasm. This is the perichondrium, this is the outer fibrous layer, and the inner chondrogenic layer that contains chondroplasts. The shape of chondroplasts, as we see here, they are flat or oval cells. They are not present inside lacuna. We said that lacuna is an empty space or a cavity or a room that houses the cells inside it. The chondroplast does not present inside lacuna. They are flat cells, oval cells present in the inner chondrogenic layer of the perichondrium, parallel to the surface of the cartilage. Regarding the nucleus, this is an active cell. Chondroplast is an active cell. So I expect that the nucleus is vesicular. When we are going to talk about the nucleus of any cell, we have to mention the number, the site, the shape, and the activity of the nucleus. For the chondroplast, they contain single central oval vesicular nuclei. As this is an active cell, so the cytoplasm is deep basophilic cytoplasm. Regarding the electron microscopic picture of chondroplasts, these are active cells. They synthesize and secrete extracellular matrix of cartilage. So the electron microscopic picture, we will find that it is for protein secreting cells. The usual organelles for protein secreting cells are ribosomes, rough endoplasmic reticulum, Golgi complex, and mitochondria. These cells also divide and differentiate to give chondrocytes. Chondroplasts lie in the inner chondrogenic layer of the perichondrium. They secrete cartilage intercellular matrix. They also divide and differentiate to give chondrocytes. These two characters of production of extracellular matrix of cartilage and differentiation to chondrocytes leads to growth of cartilage, which is called appositional growth. Appositional growth of cartilage means addition of new layers of cartilage under the perichondrium. So appositional growth of cartilage occurs by a cell called chondroplast by formation of cartilage extracellular matrix and differentiation to chondrocytes. These two criteria also makes chondroplasts important for repair and healing of cartilage when injury. So when we return back to functions of perichondrium, we said that the function of inner chondrogenic layer of perichondrium is the function of the chondroplast. These cells are responsible for appositional growth of cartilage. That means addition of new layers of cartilage on the existing cartilage. They are also responsible for repair and healing of cartilage. Regarding chondrocytes, they are derived from chondroplasts. We said that undifferentiated mesenchymal cells will give chondroplasts. Chondroplasts are not present inside lacuna. Chondroplasts will divide and differentiate to give chondrocytes. These chondrocytes are present inside lacuna. The lacuna are present within the matrix of the cartilage. This is the lacuna. It is like a cavity or a space that houses the cell. The shape of the chondrocytes depend upon their size. Superficially, the cells are oval to flattened, then they become large and rounded, then they form what is called cell nest. This is superficially, the cells are oval, become rounded, then they form cell nest. What is cell nest? This is chondrocyte divided by mitosis to give 2 cells. Then these 2 cells will divide again and give 4 cells. If these 4 cells are present inside a single lacuna, we will call it cell nest. But if they are separated into 4 cells, but they are derived from single chondrocyte, we will call it isogenous group. Chondrocytes are also active cells, so the nucleus is vesicular. The nuclei of chondrocytes also are single, central, rounded, and vesicular. This is an empty lacuna. This is a lacuna containing chondrocytes with vesicular nuclei. The cytoplasm is also basophilic because it is an active. The electron microscopic picture of chondrocytes, we know that these cells synthesize and secrete extracellular matrix of cartilage, so I expect that it contains the organelles of protein-secreting cells that are ribosomes, rough endoplasmic reticulum, Golgi complex, and mitochondria. These cells are responsible for type of growth that is called interstitial growth of cartilage. Interstitial growth of cartilage means enlargement of the cartilage from within, because these cells will divide and differentiate, forming cell nest and isogenous group, and secrete cartilage extracellular matrix. This leads to enlargement of the cartilage from within, and we call it interstitial growth of cartilage. To revise what we have taken, this is the perichondrium. It is formed of 2 layers. The outer fibrous layer formed of collagen type 1 and blood vessels, and the inner chondrogenic layer containing chondroplasts that is responsible for appositional growth. These cells are present parallel to the surface of the cartilage. They are not present inside lacuna. We have chondrocytes that are present inside their lacuna and the cartilage matrix. The important things to know that the cartilage is formed of cells and matrix like any other type of connective tissue, and it is covered with perichondrium. Perichondrium is formed of 2 layers. The function of the perichondrium depends on the function of each layer. Chondroplasts are not present inside lacuna. Chondrocytes are present inside lacuna. And chondroplasts are responsible for appositional growth of cartilage, while chondrocytes are responsible for interstitial growth of cartilage. Thank you.